It strikes swiftly and silently, often before anyone realizes the danger lurking in the shadows. The Marburg virus, a close relative of the dreaded Ebola, instills fear with its gruesome symptoms and shockingly high mortality rate. This virus, though lesser known, is equally deadly and has the potential to cause widespread devastation. It is a hemorrhagic fever virus capable of causing devastating outbreaks with alarming speed. The virus spreads through direct contact with bodily fluids, making it highly contagious and difficult to contain once an outbreak begins. The virus, first identified in 1967, has periodically emerged from its natural reservoir, leaving a trail of death and panic in its wake. Each emergence brings with it a renewed sense of urgency and fear, as communities scramble to protect themselves. Understanding the virus, its transmission, and the preventive measures is crucial in our fight against this deadly foe. Public health education, proper hygiene practices, and rapid response teams are essential tools in preventing the spread of this silent predator. The Marburg virus is a filovirus, a family of viruses known for their filamentous structure. Like its cousin Ebola, Marburg possesses a single-stranded RNA genome that encodes 7 proteins. These proteins hijack the host cell's machinery, turning them into virus factories. The virus primarily targets cells crucial for immune response, leading to a systemic collapse and often death. The Marburg virus resides naturally in fruit bats, specifically the Egyptian fruit bat. These bats harbor the virus without displaying symptoms. Transmission to humans occurs through direct contact with infected bats, their bodily fluids or materials contaminated with their droppings. Once the virus jumps to humans, it can spread rapidly through human-to-human transmission. A gruesome spectacle, symptoms and mortality. The Marburg virus disease is a terrifying and deadly illness that strikes fear into the hearts of many. The onset of Marburg virus disease is marked by sudden high fever, chills, headache and muscle pain. These initial symptoms can often be mistaken for other common illnesses, making early detection challenging. As the disease progresses, it manifests in a horrifying array of symptoms, including severe diarrhea, which can lead to dehydration and further complications. Vomiting, abdominal pain, and unexplained bleeding from various orifices are also common, adding to the patient's suffering and the complexity of treatment. The virus attacks multiple organs, causing internal bleeding, organ failure, and ultimately death in a significant percentage of cases. The damage to internal organs is often irreversible, leading to a rapid decline in the patient's health. The average fatality rate for Marburg virus disease is around 50%, a staggering figure that highlights the severity of the disease, but it can be as high as 88% depending on the outbreak and access to healthcare. The availability of medical resources and timely intervention can make a crucial difference in survival rates. Rwanda's battle against an invisible enemy. In recent news, the nation of Rwanda faces a new and immediate threat, a Marburg virus outbreak. The virus has emerged in the southern districts, triggering a rapid response from the Rwandan government and international health organizations. Efforts are underway to isolate suspected cases, trace contacts, and implement strict control measures. Healthcare workers are at the front line, battling to save lives and contain the virus's spread. Holding the line, prevention and control, the battle against the Marburg virus is a collective effort that requires vigilance and proactive measures. Preventing the spread of the Marburg virus hinges on breaking the chains of transmission. This means understanding how the virus spreads and taking steps to interrupt its path. This involves avoiding contact with bats and their habitats, particularly in areas known to harbor the virus. Bats are natural reservoirs of the virus, and minimizing human interaction with them is crucial. Strict hygiene practices are paramount, including frequent hand washing, safe food preparation, and the use of personal protective equipment when handling potentially contaminated materials. These practices help reduce the risk of infection and protect both individuals and communities. Early detection and isolation of cases, along with contact tracing, are crucial in containing outbreaks. Identifying and monitoring those who have been in contact with infected individuals helps prevent further spread. While there are no licensed vaccines or treatments for Marburg virus disease, supportive care can improve the chances of survival. This includes maintaining hydration, managing symptoms, and providing the necessary medical attention to those affected.